All right, guys, we're switching gears a little bit, and this next segment is sponsored by Moderna. So with updated COVID-19 vaccines now available, there is a lot of confusion about the right time to get a vaccine. Now, as we head into the busy holiday season, it's important to have a plan in place to keep yourself and your loved ones healthy and focus on the joy of the season. We spoke to U.S. Surgeon General Dr. Jerome Adams to learn more. And our first question for you is, what is the latest info on the current COVID situation?
Well, according to CDC, we had 16,000 hospitalizations last week. Those numbers are going up. While we are certainly, thankfully, out of the worst days of the pandemic, COVID-19 remains a public health threat, and we're going to continue to see infections rise, hospitalizations rise, and unfortunately, deaths rise over the coming weeks to months. Why? People are coming indoors as it gets colder. People are traveling, and they're encountering folks from literally all around the planet on planes and on trains and in bus stations. And also, we're visiting people who are vulnerable. We're going to see grandma. We're going to see people in nursing homes. So for all those reasons, as you mentioned, it's important that we have a plan. And part of that plan should be making sure you're up to date on your COVID-19 vaccines.
Yeah. Why is it important to get vaccinated right before the holidays? You kind of mentioned some of those things, but the essential of it, why would you say?
Well, we know that it can take a few days up to a few weeks for your immunity to really build after a vaccination, which is why it's critically important that people don't delay. They get that vaccine as soon as possible so that the protection from that vaccination is occurring right during the holidays, right when we're traveling. I'd say that's the most important thing for people to remember. And also remember, it's really easy to get a vaccine. You can go to your local pharmacy. I took my kids just last week to our local pharmacy. We walked right in. They were able to get their flu and COVID vaccines because not because they are at super high risk themselves, but because we don't want our holiday plans disrupted. We don't want them infecting other people when we can prevent it. And also, you don't know what you don't know about long COVID. So for all those reasons, I personally got my kids vaccinated, and I got my flu and COVID vaccine at the same time, one in one arm, one in the other.
Yeah. You mentioned that your kids may not be at high risk, but what age groups are most at risk for these viruses?
Well, great question. If you're over 65, hear me. It is incredibly important that you get vaccinated, get your questions answered about vaccines, because 90% of deaths are occurring in people over the age of 65. Also, people with comorbidities. I'm going to make that concrete for you. If you're taking an inhaler for asthma or COPD, you're at high risk. If you're taking insulin or diabetes medication, you're at high risk. If you're taking heart or blood pressure medication, you are at high risk. And unfortunately, far too many people don't see themselves as being at high risk when they are. Those are folks who should especially be thinking about protecting themselves. In addition to anyone in a long-term care facility or nursing home, CDC said less than 14% of people in nursing homes are up to date on their vaccines. If one of your loved ones is in that group, make sure they get their updated COVID-19 vaccine.
Yeah. Adams, where can our viewers stay updated on the latest information about vaccines?
Most important thing to do is talk to your health provider, not listen to anyone online or on media. You can go to vaccines.gov for more information, and you can check out my new book, Crisis and Chaos, available on Amazon or Barnes & Noble. Great tips on how to stay safe, along with some fun stories about people I've met like Axl Rose and Jose Andres. I try to make staying safe fun, and I want everyone to have fun this holiday season. The most important thing you can do to have fun and stay safe is to make sure you're getting the right information and that you're up to date on your recommended vaccines.
Dr. Jerome Adams, thank you so much for joining us on Marketplace, and you have a great holiday season.